Hey there, and welcome to this explainer. Today, we're literally popping the hood on the hidden machinery that's running inside of you every single second of the day. We're going to demystify how your body automatically reacts to stress, how it manages to calm down and recover, and exactly how modern medicine interacts with these invisible processes. So let's jump right into the essential guide to autonomic nervous system pharmacology.
You know that feeling when your heart just starts pounding out of your chest during a sudden jump scare? Or, oh man, when your mouth gets completely dry right before you have to step up and speak in public? What about your pupils getting wider in a dark room, or your stomach just kicking into gear to digest your food right after a big meal? Well, you aren't consciously controlling any of these actions. You don't tell your stomach to digest or your heart to speed up. These are completely involuntary actions happening behind the scenes without a single conscious thought.
Okay, let's dive into this. That invisible force driving all of those automatic reactions, that's your autonomic nervous system, or the ANS. You can really think of the ANS as the 24/7 background operating system of your body. It's the automatic control center for all of your involuntary functions. We're talking your heartbeat, your blood pressure, digestion, sweating, breathing. And honestly, the most incredible part is that it manages something like 100,000 heartbeats a day without you ever having to lift a finger.
To really wrap our heads around how this brilliant system functions, just think of your autonomic nervous system exactly like driving a car. It's got two main divisions that act as opposing forces. One system acts like the accelerator pedal. It speeds things up and gets you ready for action. And the other system? Well, it acts like the brake pedal. It slows things down and helps you park, rest, and recover. First up, the sympathetic nervous system, or the fight-or-flight system. Imagine you're out hiking in the woods and boom, a mountain lion suddenly steps right onto the trail in front of you. You need immediate, explosive energy. This is the exact moment your sympathetic system just slams on the accelerator to prepare your body for imminent danger. Your body aggressively prioritizes survival over absolutely everything else. Your heart rate immediately spikes to pump blood to your muscles. The airways in your lungs physically open wider so you can gulp in more oxygen. Your pupils become huge to let in more light so you can spot threats. But notice what shuts down: digestion. Actually, surviving a predator attack is vastly more important than processing your breakfast, so digestion grinds to a halt. Meanwhile, your blood vessels constrict to keep your blood pressure high and ready. But wait, how does your brain actually communicate that giant warning to all of your organs at the exact same time? It uses neurotransmitters, which are basically biological chemical messengers. The sympathetic system relies heavily on norepinephrine, and sometimes epinephrine, which you probably know as adrenaline. Think of these chemicals as the body's emergency messengers. They flood your system and act as the biological spark that triggers all those intense, rapid-fire physical reactions we just talked about.
Here's a super simple memory trick for you. Sympathetic equals the stress system. Whenever you think of the sympathetic nervous system, just remember the letter S. It kicks in when you are scared, stressed, and entirely focused on survival. If you lock in those S's, you'll always know exactly what this half of the system is up to.
Now for the other side, the parasympathetic nervous system, or the rest and digest system. We can't be running from danger forever, right? Eventually, we have to recover. So, let's take our foot entirely off the gas and gently press the brake. Think about that heavy, super calm sensation you get after eating a massive dinner and just melting into the couch. That is your parasympathetic system going to work. The body completely shifts its focus toward conserving energy and processing nutrients. Your heart rate slows down to a nice, calm rhythm. Digestion massively ramps up so you can absorb all that food. Saliva production rises to help things along, your pupils get smaller, and your bladder is assisted with urination. Basically, your body is resting, healing, and storing up energy for the future.
And just like the sympathetic system has its emergency messengers, the parasympathetic system has its own dedicated chemical. The main neurotransmitter utilized here is called acetylcholine. This is the specific chemical messenger responsible for sending those calming, restorative, "hey, it's time to digest" signals all throughout your body.
We've got a memory trick for this side of things too. Parasympathetic equals the peace system. Just link the letter P in parasympathetic with the P in peace. It represents the exact state your body is in when you are peaceful, relaxed, processing your food, and sleeping. So the crucial point is how these two worlds perfectly counterbalance each other. It's like a giant biological seesaw. On one side, the sympathetic system pushes you into fight or flight, cranking up the heart rate, dilating the pupils, stopping digestion, all using norepinephrine.
And on the exact opposite side, the parasympathetic system pulls you into rest and digest, dropping the heart rate, constricting the pupils, and ramping up digestion, all using acetylcholine. They are perfectly balanced to keep you in equilibrium.
Moving into Section 3, Pharmacology, the locks and keys.
So how does human medicine actually step in to manipulate these biological systems? It all comes down to locks and keys. Medicines work by attaching to receptors in your autonomic nervous system. Think of these biological receptors exactly like literal locks on a door. The drugs or medicines you take, those are the keys. If the correct key is put into the correct lock, it turns, and a very specific biological effect happens. It's that simple.
Now, because we have two different systems, we obviously have two different sets of biological locks. For the P system, we have cholinergic receptors. These are the locks activated by acetylcholine, and they come in two main flavors, muscarinic and nicotinic. On the flip side, for the stress system, we have adrenergic receptors. These locks are activated by norepinephrine and adrenaline, and they're divided into alpha and beta receptors. By designing drugs that target these highly specific locks, modern medicine can literally mimic or block the signals of either system.
Let's look at real-life clinical connections, or what we call balancing the scales.
But why does any of this actually matter to you in the real world? Well, these everyday examples show us exactly how standard medicines directly hack the ANS to save lives. Think about an asthma attack. Asthma medicines are designed to stimulate the sympathetic system's locks in the lungs, forcing those airways to open wider so you can breathe. Blood pressure meds, like beta blockers, they fit right into the heart's locks to intentionally slow your heart rate down. Even those annoying eye drops at the eye doctor interact with this system to force your pupils to change size. And in life-or-death emergencies like a severe allergic reaction, a massive dose of adrenaline is used to forcefully kickstart the sympathetic nervous system and literally keep a patient alive. Clinical issues ultimately pop up when things are pushed to the extremes. If a person has way too much sympathetic activity constantly firing, it can cause severe hypertension, chronic anxiety, and a dangerously rapid heartbeat. Conversely, if there's too much parasympathetic activity, the scale tips the other way, causing a dangerously low heart rate, excessive salivation, and severe digestion issues. This is exactly why pharmacological drugs have to be balanced so incredibly carefully. They exist to gently nudge these systems back into perfect check.
Let's do an energetic final quick revision to cement this in your brain forever. Scared equals speed up. That is your sympathetic system rushing in to save the day. Peaceful equals slow down. That is your parasympathetic system stepping in to help you heal. It is literally the ultimate super easy mnemonic.
Your body has two hidden control systems. One helps you survive danger, and the other helps you recover, heal, and rest. It's an amazing piece of biological engineering. But I want you to consider this. In our modern, fast-paced world, your brain can't always tell the